There are more neurologists west of the 405 in Los Angeles than there are in the whole of South Africa. We came up with this program that, I've and my family have had this personal experience. Let's try and, give something back in that regard. So what could we do? And I said to them, well, let's try and get some neurologists, either young doctors who are looking to take a path into neurology or early stage qualified neurologists to come over here to UCLA and give them the training. And then afterwards, when they return to South Africa, they will have the ability to have a bridge with UCLA and to carry on those links in research.
The idea of training somebody and reaching the most people, this is the best way, right?
As a passionate South African intern doctor, I experience on a daily basis the crucial role that the public healthcare sector plays in meeting the high demands of medical care. The public healthcare sector serves 84% of the South African population. Young doctors, like myself, are expected to rotate through underserved primary healthcare clinics, as well as do a year of community service at a rural healthcare facility. One of my patients had been visiting the clinic for 2 years, and it was due to my training at UCLA that I was able to correctly diagnose him on very first contact and thus provide him with the correct treatment.
So if I went down there, I could see a whole bunch of people and that's it, it's over. But if you train him, not only is he seeing a whole bunch of people, but now he's training people. And so it's going to be an exponential way of growth of education.
My training at UCLA has been invaluable. I did not just acquire knowledge on movement disorders, but I was also exposed to cutting-edge research and witnessed medicine being practiced in a resourceful and unconstrained environment.
This is an incredibly cost-effective program. Basically paying for their flights over here and their housing costs, and for them to be able to buy food and live, because these people, the people we're bringing over don't have a lot of money. They can't afford, a whole lot. They're scraping by.
It was through donations that this experience was made possible. This opportunity offers world-class expertise to the underserved and impoverished populations of South Africa.
None of us get paid for this. We're all volunteering our time. We believe in this because we think it's a worthy cause. So a small donation doesn't cost that much money in the big scheme of things, and a small donation really does make a huge difference.
A $15 donation could be a textbook for another young South African doctor to receive this invaluable training.
Almost anybody who learns about this and is touched by it, they want to give because they know what a big impact this has.
This is really part of a process which I hope people will join us in, give us the support that we need, and really take what are small stepping stones at the moment and generate that into a really comprehensive program where we can help not only the general population in South Africa, but also in other areas of Africa ultimately, because South Africa has such an influencing factor down there.